a sports physiotherapist working in the Sports Institute, but have previously done a good bit of work with Athletics Ireland. So that's just some of the sporting bodies that I've worked with, but that's not what we're here to talk about today. We're going to talk about, this is just an overview of today's presentation. So we're going to look at injury prevention in young athletes, kind of risk factors that might be associated with injury or risk factors that may lead to an injury, proactive measures that you can use in order to help to reduce the likelihood of injury. And then we'll have a chat about dealing with an injury or setbacks, and maybe little tips that you can implement that can help you overcome that. All right. So why do we get injured? Now, there's loads of different reasons why you get injured, and that's my job. Would be great if it was only maybe these couple, but these are some of the big ones, and it's the low-hanging fruit that I suppose that we can address to help us kind of maintain healthy bone and healthy tissue. So overtraining and poor load management, we'll kind of delve into that in a while over the next couple of slides, but that then leads to insufficient recovery. So those two probably go together. The other few then is just our recovery protocol. So sleep hygiene and nutrition. I think personally from a physio standpoint, if you got sleep, hygiene, nutrition and load management and you got those three right, you can probably forget the massage guns and all those couple of other pieces, because that's the low-hanging fruit that's really going to kind of get you over halfway there. The likes of running economy and mechanics, no athlete really moves the same. And for me anyway, running economy or mechanics is only an issue if it's causing an issue. So I don't personally look to it. That's not my job. That's the coach's job to look at mechanics and how they move. But if it's causing an injury, then that can be something that we could maybe look to address. And the last one then is just lack of structured or periodized strength training. So if we're young athletes and we're only starting out, you might be a 15-year-old athlete, but your training age might only be 1 year. So we need to really make sure that your strength training is something that's going to complement what you're doing, that we're not just going to the gym and lifting weights for the sake of it, that there's intent and purpose behind what we're doing. So they're just some of the reasons why we get injured. All right. Now, I can't prevent you getting injured. All right. It's not possible. And I think if you look on Instagram and you see people talking about bulletproof and hamstrings and stuff like that, it's not always possible. So this is why we need to focus on the factors that we can control, and that just reduces the likelihood then. So these are the couple of things that we'll probably look at what you can control as an athlete. So your training volume and intensity. Okay. So having a structured plan around, what's my next 6-week block going to look like, or what does my week look like, and how you can turn up the dials with regards to volume and intensity and frequency. And we'll delve into that in a couple of slides. Prioritization of sleep and nutrition. That's the two big ones for me. I think if we can get those right as a young athlete, it just sets you up. Strength training is something that we can implement as an injury preventative measure. Recognizing your current training capacity. So as a young athlete, it can be difficult because you'll have two similar athletes of a similar age, maybe on a completely different continuum, both going to the same direction, but just not moving at the same pace. And that could be like growth spurt. It could be down to, just like we said, training age, these small little things. So you need to kind of look at where you're at in your training and not compare yourself to someone else. And then monitoring your training load. So we all have watches, or some people wear Whoop bands or Oura rings or whatever. That could be as simple as a pen and paper. So just RPE, score your session. I trained for 40 minutes. It was an 8 out of 10, and you're constantly monitoring your training load. So then we can manage what we're measuring, essentially. So this is the first point that was on that list. So overtraining. It's probably something that it's really come to the forefront now in regards to a lot of athletes. And I think youth athletes definitely can kind of be exposed to overtraining, not unknowingly, but a lot of us will play across a different few codes of sport as a young athlete. So we might have, someone who's playing rugby and soccer and doing athletics at the same time. and they're doing them all for their schools while their others are doing them for their club. And then if that goes well, then they get brought into maybe some of the national squads. And all of a sudden then, they're training all the time. In addition, then you have all those kind of other factors like school, like work, that are also causing stress on the body. So overtraining, the exercise-related symptoms of what it looks like is maybe a plateau or decline in your performance or progress. So that might be, you might notice it, or your coach might start to notice it. And then a session for you that might have normally been, an easy session, so you would have scored it at maybe a 5 out of 10, is now becoming an 8 out of 10, even though we're still doing the same amount of work, but we're just not recovering quick enough. And it's not allowing us to, shake off the feeling of heavy, stiff, sore muscles, and we're not feeling refreshed after we train. Point 5 is that's one that that's where I suppose the physio comes in. If we start to notice that young athletes are presenting with reoccurring muscle sprains, tendinopathies, stress fractures, or just chronic joint pain, that's what we need to look at and zoom out and look at training load. Because if we're constantly picking up these little knocks and niggles, 9 times out of 10, there's a reason why. Okay, acute injuries are different, but a chronic reoccurrence is something that we can definitely address, and it could be related to overtraining. And that last one then is just a decline in enthusiasm for your workout. So with regards to overtraining, these, so I suppose, mental and emotional changes are also something that you need to be aware of. Okay, so that could be, a decline in motivation or self-confidence, because for you as an athlete, you identify as being an athlete. So when that's taken away for a short period, it can be difficult. Lack of enjoyment in hobbies or other interests, and then just unusual kind of moods or emotions such as agitation, anger, confusion. These are all, I suppose, mental and emotional changes due to overtraining. Problem with concentration and performance at work or school, in addition to, problems with sleeping, that can also be a factor. So if you're someone that monitors your sleep and you see that, you have a really heavy block of training and your sleep has been poor, that may be something got to do with, right, am I doing too much? Or am I doing that much that I'm not allowing myself to, I suppose, recover enough that my body can adapt? So even though exercise has to have an overload stimulus, if we don't allow our body to adapt, then we never have that level that we can push up. So this is something then that kind of leads us to what is load and how do I manage it? So the IOC, so the Olympic Committee, defines load as the following. So for me, what kind of gets left behind with regards to load is the non-sport burden at times, okay? So you've got sport and non-sport burden as a stimulus that's applied to the body. And that load can be applied to the body over varying time periods. So seconds, minutes, and then it can be a varying magnitude. So that's duration, frequency, and intensity. So load doesn't just come from the training session. Load management, if we're looking to manage, we need to look at the whole picture. We can't just look at one track session. And then managing that load is defined as the deliberate temporary reduction of external physiological stressors, but that's intended to facilitate the athlete's improvement, okay, to allow them just to recover and basically perform better over the long term. But you need to address the internal and external factors. So in addition to, obviously, because most of us think of load management and we say, right, I just need to take one session out of my week. Well, maybe we didn't need to take that session out. Maybe we were really stressed at school, or maybe there was something else going on that we weren't, that was kind of bugging us in the background. Maybe we just needed to have a look at this, in addition to maybe taking the intensity down, and then that manages the load better. But you have to look at the whole continuum. So this here is just like an example of, in terms of how we could possibly manage if we were, and this is just for a runner, but how we could manage volume and intensity. So the volume of our training refers to the quantity of training or the amount of work performed in that training session. So that could be repetitions, sets, distance covered, whatever. And then with regards to intensity, that's the level of effort that in relation to the difficulty of that exercise that you're performed during training. Okay. Now, sometimes that can be subjective. It depends. Most of the time, we're not going to have, I don't know, GPS monitors or stuff like that on us. So we're just going to maybe just use RPE. So rate of perceived exertion. How did you find that session? And that's how we could maybe measure intensity. The volume then is measured, obviously, between you and your coach setting out that session. And then frequency, that indicates how often training sessions or workouts are performed in a given time period. So depending on how you set out your training block, it could be 6 weeks, it could be, it could be 1 week. And then periodization, just at the bottom, that's a systemic planning of your training program, and that could be organized into different phases or cycles. So depending, and it might be at the minute, we might not be kind of going into like that specialization route of, this is my event or this is my distance. So we might be in that kind of where we're just going to feel in our way out. So this mightn't be as important to you just yet, but if it is, there'll be different parts within that training cycle that you can kind of adjust to prevent overtraining. And then that ensures that you can peak at specific times, allowing for long-term development. So you might factor in like a deload week at week 5 on this training block. And you know that when you get to that point, that's your body's chance to just readapt and then just push on to the next level. But if we're constantly hammering away, and we never give ourselves, room to breathe and to allow the body to recalibrate, then that could just lead to possible injury. So this is our first runner. So and again, this is all just hypothetical, but they've been running 3 times a week with an intensity for 25 to 30 minutes each run. And they decided that they're going to run an event and they need to increase their training load. So what runner A is going to do here, he's going to increase one run to 45 minutes. So that's a 50% increase on, his weekly load in terms of, if he was running for 30 minutes previously, there's now an extra 50% on top of that run. And he's going to make 2 of those runs harder. So he's going to dial that intensity right up. And the frequency stays the same. So that doesn't change. Whereas if we look at runner B, maybe what he's going to do, so he's doing the exact same thing. He runs 3 times a week with an easy intensity of 25 to 30 minutes each run. So they both have the same training background. He signs up for the same event, he or she, and he decides, right, I need to increase my training load. So what he does is he increases one run to 45 minutes, but on week 3 and 4, because he's been responding well to the extra run. So he's added in an extra run per week for 4 weeks, but at a really, really easy intensity. So the frequency has gone slightly up. The volume has gone slightly up, but the intensity has come right down. So he's allowing his body to recalibrate. And now that he's given him some time to adapt to the extra run and the volume, they're keen to add a little bit of intensity. So he reduces the total volume, but the intensity pushes up a little bit each week. So 2 same runners, both running the same event, but 2 completely different build-ups into that event. So if we look at kind of maybe what the outcome might be, runner A was probably a bit anxious that they weren't doing enough training. So that's why he dials up the volume and the intensity. And what happens is he's not giving the body enough time to adapt. And then our risk of injury goes right up. Whereas runner B, because they've been building that frequency and intensity quite gradually, there's a solid base there. So there's no problem with adding intensity when they've already kind of built the foundations. And the likelihood is then overloading tissues, so kind of tendinopathies or stress reactions, they won't happen because the body's able to say, well, look, this has been a gradual build-up and it's not under as much pressure. So that's just an example of how we can play about with our load. If you were to think that, you had to make changes. So now we're going to talk about recovery. So we picked some of the main topics that we spoke about in the few slides above. So we're going to look at sleep. I'm not a nutritionist. There's loads of people that are far more qualified than me, but I recognize its importance in injury prevention and recovery. And then we're going to talk a little bit about strength training. So maybe just some tips that you can implement with regards to strength training how it can help you as an athlete, and then maybe tips on how to implement them into your week. So everybody talks about sleep at the minute, and it's really big. But not a lot of people maybe question what's the importance of it. We know we feel better, but how as an athlete is that going to make you better? So if we look at when you're asleep, that's your body's chance to repair and regrow. Okay, so it strengthens the immune system, builds bone and muscle. And these then, in turn, contribute to increasing both strength and endurance, two pillars of performance with regards to an athlete. Okay, so if we're not, and this is something you do it every day, so do it well. Okay, and I'll give you some tips on the next slide about how to do that. So there's certain studies have shown that with regards to reaction time and accuracy, okay, again, two really important performance indicators for any athlete, have improved with regards to improved sleep. Mental well-being, okay, so adequate sleep can boost mood, focus, and decision-making abilities. And again, these are all crucial components of being an athlete. And then the last one, okay, is with regards to recovery. So this is where, in addition to obviously sleep is good for these performance indicators like reaction time, accuracy, or strength and endurance, recovery is the big one. Okay, so when you're asleep, your body produces a growth hormone, which is essential for growth repair. So we've had kind of, I suppose, incidents with athletes who were trying to do more when in fact all they needed to do was just dial it back and look at these factors. So they were getting up maybe earlier to do more work in terms of, say, it was run or a gym session. And what was happening was they weren't seeing the same performance increases. But when we looked at what the sleep schedule was like, where they were placing those, those early morning track sessions or those early morning gym sessions, it would have actually just been more beneficial for them to get that extra hour or two sleep to allow them then to repair and grow. So for you as an athlete, that's where you need to factor in, how can I boost my performance in addition to recovery? So some tips on how you can improve your sleep. So it's not always possible with regards to maybe school or kind of routines outside of training, but a consistent bedtime and a relatively consistent wake up time. So I know we all like a lie-in on the weekend, and that's okay. But if you can establish, a relatively routine pattern, it just means that your body clock, it starts to develop, no different to anything else, a habit. Okay, so it knows that come 10 o'clock, it'll start to shut down, but you need to allow it to shut down. And that's why establishing a pre-sleep routine is really important, because that signals to your body, right, it's time to start winding down a little bit. Now, one of the things, we all do it, we know we shouldn't do it, and screens at bedtime. So the light that comes from your phone ends up altering so the body's production of melatonin, and that's a hormone that regulates sleep. And I know people are wearing Blu-ray glasses, turn off the blue light on their phone, but the best thing to probably do is about between 30 to 45 minutes before you go to bed, is just put the phone away. And whether that means reading a book or whether it's just relaxing, and all that does is it just makes sure that it allows your body to start to I suppose, wind down and creates that environment for it to be able to sleep. Now, sleep-friendly environment. So what they recommend is a cool, dark, and quiet room in order to promote a deeper sleep. You don't need to be sleeping with masks and stuff like that on, but it's just creating what works for you. Okay, I know some people who a cool room, they don't find it comfortable. So find what works for you, but this is what the research recommends. So limiting caffeine, especially in the afternoon and evening, okay, as it interferes with sleep. So caffeine has a half-life, and what that means is if you consume caffeine, it doesn't just give you that boost that we all look for maybe before a track session or before a gym session. It lingers in your body system, okay? And what happens is if we're taking, so say you have a track session at maybe 7 o'clock, and you decide, well, I'm going to drink, I don't know, a Red Bull or a NOCO or one of these energy drinks before training at 7, that's still in your system then, and you're trying to sleep at maybe 10 or half 10. So it's only 3 hours later. So just limiting the intake. It doesn't mean that you have to have none. And I know some of us like to use it for performance. But just be cognizant of the fact that if we're looking to boost our recovery and our performance via sleep, then you just need to be mindful of when you're taking that caffeine. And that last one there, again, is just avoiding large meals before bed, as sometimes it can just cause indigestion and interfere with sleep. But this is the big one in terms of it's helping reinforce, okay, good habits within the athlete. And then when you're asleep, it can just allow that body to repair. And this is when you can perform and learn new motor skills. Okay. So the next one we're going to talk about is strength training and the importance of it. So we all know that as an athlete that we are going to, strength training is just a non-negotiable. And that's regardless of the event. I have some distance runners that come into the clinic and, they don't put as much emphasis maybe on there because they think, oh no, well, maybe the sprinters just need to be doing the big heavy lifting or the throwers need to be doing the big heavy lifting. Strength training is important for everybody, and that regardless of whether you're running a marathon or whether you're running 100 meters, because what it does is, in addition to obviously improving performance, it just means that you're going to build fatigue resistance within that tissue, so that when you go to perform what you need to do, it's not a shock to the body. It's able to do what you need it to do. So for example, a calf muscle, roughly when you're running, takes 7 to 8 times your body weight through that calf Achilles complex. But if we've never overloaded that calf, well then while we're pushing up the mileage and we're pushing up the intensity, we need to be able to build the fatigue resistance within that tissue. And we can do that via strength training. So strength training aids in joint protection and obviously muscle support. So, but the likes of, I suppose, some of the conditions that we might see as a young athlete. So the likes of maybe Osgood Schlatters, and these might be things that you've had: patellofemoral pain, Achilles tendinopathies. These are all these overuse injuries. So if we can get stronger, because the muscle has to get strong, because what happens is if the muscle is not strong enough, the tendon is stronger, and then that takes the load. And that's when it becomes annoying because the muscle can't do what we need it to do. So we need to get stronger from the muscle in order to protect the joint and the tendon. In addition to, sometimes we can look at, and again, like I said earlier on in from some of the earlier slides, running form and running mechanics. Sometimes we can improve that via strength training, in the sense of if we've got an imbalance, maybe with, just for talk's sake, left and right. So we know we've got decreased strength on our left side, so our right side dominant. And then when we run, if we run any sort of a distance, that we might start to fatigue early on the left side. And as a result, then that can lead to an injury. So that's when we would use strength training to try and iron out the creases, maybe between left and between right. In addition to that, obviously, it helps to enhance recovery. So some of the considerations that you might need to consider before you start strength. So like I said, you might be an athlete who's on this call and you haven't started your kind of gym pathway yet, right? And that's fine. So what you need to do is to look at, where does this fit into my training plan and how is it going to benefit me? So what's your specific needs with regards to strength training? So we're not just going in and doing loads of bicep curls, because what we should do, we're going in and going, look, well, if I am competing in this event, how can I funnel my strength training that's going to help me improve my performance and then prevent injury? Okay. In addition to, obviously, we spoke about before what your current capacity is, injury history is obviously a factor in it. So you're not going to start strength training before liaising with your coach, or maybe your physio or your strength and conditioning coach. But progressive overload, it has to happen for your exercise to be effective, the same as running, the same as throwing, any of these events. There has to be an overload stimulus for an exercise to be progressive. But what you want to avoid is these sudden spikes, because that's where the injury happens. So without going down too much of a wormhole, you can split kind of workload into acute and chronic workloads. What can happen is, if that's skewed and there's too much on one, then we see these constant spikes are unaccounted for, and then that could possibly lead to injury. So if you're an athlete, you're an athlete first and foremost, so the strength training should be complementing what you're doing. So this next piece, so like I said, disclaimer, I'm not a nutritionist by any means, but I do recognize how important it is in order for us to be able to perform, okay? So you cannot perform without a proper energy balance. And that's basically calories in, calories out. So if we're burning more than we're consuming, the likelihood is we're compromising our health and possibly risking injury. So proper nutrition provides essential nutrients, vitamins, minerals, and antioxidants that support the connective tissue. So everything that holds us together, so the tendons and the ligaments and the muscles, and then the bones. So if we're fueling properly, because we know that underfueling can lead to the likes of, stress responses and stress fractures, because we're hammering our body all the time. We're not giving back to it in terms of nutritional content. So by you giving back to the body, you're allowing it to recover again. And it's just feeding back into those last couple of points that we spoke about above. Protein is something that I suppose it's at the forefront of most people's mind when they think of like gym, or they think of, nutrition. Protein is important, and it's crucial in order to allow you to repair, recover, and grow. But you can get that protein from a normal, healthy, full food source. It doesn't have to be these, manufactured shakes. So just taking that into account. And that point number 3 there is just, there is certain foods like omega-3 fatty acids and antioxidants that can help reduce inflammation in the body. But like I said, if you wanted to delve into that a little bit more, it might just be worth talking to a nutritionist. So this is this last bit here is dealing with an injury. So a lot of athletes come in after getting injured, and the first thing they're going to ask me as a physio is, how long am I going to be out for? And sometimes, majority of the time, I don't always have that that answer, sorry. It can be different. If someone comes into me with an acute, I suppose, grade 0A hamstring, roughly, I'll have a time frame on my mind. But that's before I delve into all the subjective history, like what's the athlete's training load like, what have they been doing previous to this? Some of the other questions that you might be asking yourself is, what if I can't compete at the event I was planning my whole session around? Or what am I supposed to do now that I can't train? Or I just feel like giving it up because I can't compete and I can't train with my friends. So it's just getting on top of you. So the next slide is just some tips on, sorry, that's not the next slide, but we will just talk about some tips on what you can implement. So this normally is what most people think that the rehab journey is going to look like. So you're going to come into me, it's a small little niggle, and it'll be this big straight continuum all the way up, and you'll be back running in a week, no problem. And if it did look like this, it would be brilliant, and it would make life a lot easier for me. But this is normally what your rehab journey probably looks like. Okay, so you can see there's peaks and troughs the whole way up. It's still getting to the same point. So the continuum is still the same. So it's 2 points. It's just that there's ups and downs the whole way through like that. So you might, first 2-3 weeks going really well, and then we have a drop down. And you can't understand why, because you've been doing everything the physio has told you. But then after a chat and maybe a consultation, or we make small little changes, you can see there that the progress starts to shoot up again. All right. There might be a slight decline again somewhere along the way. You might get a flare up because we've done too much too soon, or the body just wasn't ready for that, even though we thought it might have been. So we just recalibrate, and then we'll just back up on that same continuum. And you can see there, feeling much better because you've addressed all the little aspects that may have been affecting performance. So, like I said, same pathway, just different journeys. That's all that is. So some of the common errors which I often see with athletes is that, they present with one injury, and all of a sudden then they just decide to let the air out of the other tires, because they're thinking, right, well, I'm injured, nutrition doesn't matter. I'm just gonna kind of let the wheels off there. I'm going to pull up the handbrake here with regards to my my rehab or my exercises, and I'm just going to, not focus or not set goals, whereas I previously would have. Okay. And the other two there, so poor communication or ignoring mental health. So sometimes it can be difficult when you get injured, because the psychological aspect to any injury, especially long-term injury, is just as important as the physiological aspect, okay? And if we don't address those, or we don't keep those at the forefront of our mind, then we could be doing all the best rehab in the world, and we're still not getting to where we need to be because, you know, we haven't addressed those 2 points. So they're just some of the errors that we see during injury. So kind of a points to avoid, I suppose. And this is just leading on what I was speaking about in regards to the physiological aspects of injuries. So they're tough both mentally and physically, okay? So time and dedication is required, and this is more for the long-term injuries. But there's going to be highs and lows. But you need to remember, if we take back to that slide a couple of slides ago, we're still on the same pathway. It's just peaks and troughs. That's all that is. Okay, so, but just bear in mind, with the likes of the physiological aspects, you need to keep kind of open channels of communication with coaches, with parents, with friends, especially if you're going through it, knowing that you're not going through it alone, I suppose. So these are some of the tips with regard to dealing with an injury. So that first one is just what I was speaking about there, is forming that support network of friends, coaches, family, etc. So you can kind of lean on them and, you know, just say, you know what, I'm actually finding this injury hard. I thought it was only going to be 3 weeks. I've been out for 8 weeks and I kind of don't know where I'm going with it. And all of a sudden then, you know, you can find reassurance, and it mightn't, your friend and your coach mightn't have the answer, but at least you've spoke to someone about how you feel about the injury. And even if it is your physio, then he can maybe kind of reassure you. So, you know, by staying informed with regards to your injury, it allows you to process it a little bit more. And then you can set your short-term and long-term goals as you would with any season. So if we weren't injured, we would set short-term and long-term goals for our training. So this shouldn't be any different. So we're in rehab, you're coming to me, we'll set, right, these are our goals for this week. This is our goals for the 6 weeks. And that's something that you can do even just for yourself, you know. So if we had, I don't know, say we had a bad knee injury. So today I want to, you know, walk pain free. Tomorrow I'm going to cycle 20 minutes. And it just gives you almost like a rehab pathway and clear, concise points on which you can tick off then. Controlling the controllables. So that's like with regards to the recovery pieces that we spoke about above. So nutrition, sleep, that's low-hanging fruit, that it doesn't require any level of, I suppose, skill. It just requires discipline and effort. And they're things that can have a huge impact then on your recovery. Engaging in hobbies outside of sport, I think that's really important with regards to, I suppose, when we've got athletes with long-term injury, we often would look to get them to see, because the whole emphasis, if it's only on the sport and we only identify with an athlete and that's solely that, what can happen is when that gets taken away, we struggle a little bit. So if, you know, to take your mind off something, whether it's playing music or it's going to the cinema or it's just, you know, I'm going to take a little rehab break today and I'm going to enjoy, you know, a bit of fun with family or friends, is implementing that. And that can help. We often do that. We dial in rehab breaks or rehab holidays, we call them. And it could be for 2 days, it could be for a week, depending on how long the injury is. And that can kind of almost recharge the batteries a little bit for that athlete. And that last point there is, if it's something that we are really struggling with, we can consider kind of psychological support, and, you know, your friends, your family, your coach can help put that into place. So don't feel like you can't chat about it. And I suppose this next one, dealing with a recurrent injury, what do you do? Because it can be difficult. If you've got someone who's coming back to you and they're saying, look, I don't understand, why is this happening to me? It can be useful to reflect on not what's happening now, is what were we doing well when we weren't injured? So, and that's like we spoke about, internal and external factors. So I'm injured now. What brought me to this point? Was I pushing too hard at training? Was I stepping off on my injury prevention and rehab or my strength training? Am I going through exams at the minute and is my stress levels through the roof? Or is something going on at home, maybe that, you know, my sleep isn't great and I'm not eating the way as I should be? And if you can maybe tick 3 or 4 of those boxes and you go, oh, actually, right, this makes sense. So now we just need to address these points in addition to obviously addressing the injury. Deload doesn't have to be, you know, pull up the handbrake and we're going to offload completely. But you need to listen to your body. So there's that book, The Body Keeps the Score, I think is the name of it. And it does. Your body will let you know when it needs a break, and you might want to listen to it, but your body will let you know, and you'll see that in tissue damage or inflammation. And it can be a cause for concern. Like, we've all done sessions where we've had DOMS the next day, and that's a normal physiological response. But we might just need to bring it back and look and go, right, this is actually, it's more than DOMS. I'm actually pushing too hard here. So we might look and say, if we deload slightly with the injury and take stock, it allows you to have a look and see, are there possible training errors that I'm consistently doing every time I get to that point where I'm nearly back? Am I pushing too hard? And do we need to maybe sit here for another extra 2-3 weeks to allow you to get back to where you need to be? And that's how you form your training plan with your physio or with your coach. So this is a kind of, I suppose, a quote that I really like. That rehab is just training in the presence of an injury. Okay. So there's simply 2 points on the same training continuum. So if you're looking to run X, or you're looking to throw X, that training continuum is still this. It just means that in the middle, no different to the 2 slides that we showed, there's a slight little upwards and downwards trend that we might just need to kind of reevaluate with it. But if we view rehab as training, all of a sudden, then we've just, I suppose, you've changed the narrative, and it's now a positive outlook. So now I can go, right, I am injured, but what can I do? What can I change about myself or my performance now that can make me be a better athlete? So that might be just sitting down with your coach, your parents, your friends, and explore different areas of maybe weakness, and have open and honest conversations with your friends, yourself, and say, do you know what, actually, I'm not probably doing enough strength training, or I probably am pushing too hard here, and I can see that it's coming on. So all of a sudden, then you've now picked apart little pieces that by the time you get back to competing injury-free, you're now a better athlete. You're more well-rounded because you've addressed loads of performance indicators that maybe before we weren't looking at until we got injured. Okay. So that last slide is just something that we say to all of our patients. So if you change your narrative, you can change your mindset. So with regards to an injury, it can be difficult because you can think, oh, this is me now. Why did this happen to me? Whereas, like I said in the slide above, if you can kind of change that outlook, and it's not trying to be glass half full, it's just being practical and say, right, I am injured, but let's find out what I can do, and do loads of that. Okay. So I think that is me. So thank you very much for listening, folks. I hope you got something from that. And if you have any questions, fire away.
Thank you so much, Robbie. That was fantastic. And I was even picking up some bits myself that I can apply to my own training as well. And I'm sure some of the coaches did too. So positives all around. But yeah, guys, if you have questions kind of specific to what we've covered here this evening, feel free to unmute yourself now, or you can pop them into the chat box and we can try and answer them for you here. It's a great opportunity to get your questions answered while we have Robbie on the call.
Okay. I see there's a couple of questions there in the chat box, actually.
Yeah.
There's one from Elaine. So what are good foods to eat on the day of your competition? So again, I'm not a nutritionist, and I would never claim to be. But what you can do with regards to, so the day of the competition, it is important, but probably the 2-3 days prior to the competition, which is even more important, because you want to make sure that you're fueled the whole way into that. So it depends on what point in the day, obviously the competition is, what you need to fuel for. Is it an endurance event? Is it something that you're going to need more carbs for that day? Or so if it is a case of on the day, normally you're looking at substantial kind of carbohydrates. But again, I'm not a nutritionist, so I'm not going to delve too much into that one. And the next one there's from Porrick. What can I do to help motivate myself to do more training? I suppose it's probably not a difficult one, but what would be demotivating you, or what are you finding? What's your barrier to training? So if you rely solely on motivation and to get you to training, that probably won't last very long. So we tend to form habit loops. So if because there's going to be days there, like when it's wet and windy. I think Saturday session was something like that. You don't want to go and train, and if you're relying on motivation alone, it can be difficult. But if you're struggling with motivation, maybe just a couple of group sessions, get out your friends, and say that I'm not going to enjoy my training at the minute. Change something about your training. Talk to your coach. They're just a couple of small little bits that you can do. But relying solely on motivation probably won't last for too long, is what I would say for that.
Yeah, I think it's a good point, and it's something that we're trying to, I suppose, harvest a mindset in the squads about, connecting with other athletes in different clubs, that like you can create more of a community of practice, because athletics can be a lonely sport at times. So making sure that we have those connections and making it as social and fun as possible. Because I think, no matter what stage of your athletics journey you're on, for the most part, you should be doing it because it's something enjoyable and fun and that you love to do. So try and find those things in your own training, and hopefully that'll help.
I think as well, you'll find that by speaking to other athletes or by speaking to your coach, and being in a group setting, you'll pick things up from other athletes. Like no different to when you're in the warm-up area and you see athletes doing, drills that maybe you didn't see, and you go, "Oh, I like that." It might be a case of that you're trying to train a partner, he or she was actually struggling with motivation, 2-3 weeks ago, and you found that X helped. So I think definitely kind of getting in a group can definitely help.
Super. There's another question there around sleep, what we were covering earlier on. What does good sleep look like? Is it loads of deep sleep?
Yeah, so this is one that's kind of, I suppose it's not loads of deep sleep. So they talk about like the quality and the quantity of your sleep. The good sleep for me is like, you don't need to have, people have this, I suppose, and those monitors that people wear they can be skewed at times, because there has been research or data done where people have worn an Oura ring and a Whoop band, and they've completely different scores from the same person that slept that night. Good sleep, you don't need to have 5-6 hours of REM. There's like certain levels of deep sleep that are appropriate for youth athletes. Some of the younger athletes will need more. But for you, good sleep probably looks like, if you're feeling up, so if you've done your track session, you've gone to sleep, and you've created, like we spoke about, that, the good sleep hygiene, and address those couple of factors. What you'll find is you're waking up and you're feeling refreshed. You don't necessarily have to be monitoring and looking at REM and deep sleep or rapid eye movement. You can even just look subjectively, how do I feel? And if you're feeling refreshed and recovered, and you're feeling, you have a positive outlook going into that day after that, then that for me is what good sleep would look like for youth athletes.
Brilliant. I think that's actually really good advice, because sometimes we can get very caught up with all the data. And just going off those subjective scores, it can be better and easier to manage as well.
Yeah, because I think nowadays with the people can get lost in the data. We've had some athletes where we've actually had to ask them to stop using them, because what's happening is they're waking up in the day of a competition, and they're saying, like, come into the physio room and they go, "Robbie, like, I've got a red recovery here." Then psychologically that's playing on their mind, even though subjectively, if they just maybe took stock of how they're feeling okay. They're basing what their performance is going to be on a metric that might not be completely accurate to them. Now, all these big brands will argue that they are very accurate, and they could be, but you also need to maybe just take it with a pinch of salt.
Yeah, absolutely.
Hi, Robbie. How you doing? Dermot McGrannon here. How's the form?
How you doing?
Hey, Dermot.
How's it going? All right. Hi, Grace. Rob, just yourself, Robbie. I have a couple of athletes that's probably on the call here, right? And One of them would be struggling a lot with tight calves all the time. Maybe when you do a build up of training, one thing or another, and struggling big time, and he's doing a lot of rehab and one thing or another. But it seems to be coming on him all the time. Have you any quick fixes? I know there's probably no quick fixes if I had you diagnose anything like this, but he's been struggling this last couple of years. But then when you come in onto his grand start of the year, but when you come in then to national championships area. He seems to be struggling a bit, and he's probably on the call. And I know he won't ask, so I thought I would ask for him.
Is it calf tightness he's struggling with?
Yeah, really tight calves, and you can see him in the sessions. One thing or another, trying to stretch them out, and one thing or another, and it's not working. And he has been doing a lot of rehab, a lot of stretching, and one thing or another, calf raises and on the stairs and everything that they're trying to tell him.
What's he running?
He's running across country about 3,500, 4,000 meters.
And he's obviously wearing spikes.
A lot of things on flats.
Okay. See, with regards to the calf and Achilles complex, they've done. It's a question you get asked a lot with regards to, say, cramping or that increased calf tightness. And normally tightness, it presents as muscle tightness. It can often be like a decreased fatigue endurance or muscle weakness. So depending on, I know with I don't think I don't have the normative values for an underage athlete, but I know for adult athletes, we look for them to push on certain calf exercises. We look for them to have about 1.5 to 2 times body weight on that lift. So it means that then when they're running, that they build up fatigue endurance in it, and you'll do that in bent knee and straight knee. But if he's already doing the rehab and he's got good calf endurance or calf strength, then you're kind of probably looking at, well, what's his weekly load looking like? And like I spoke about there, is there factors that are affecting? So if he keeps a training diary, can he look and go, right, I get calf tightness when I do X? Or you said there, it's at a point in the season. He's grand at the start of the season, and it's at the end of the season that he starts to pick these up. So is it a case of that's a cumulative load, and we need to dial in like a little, like I said, like a I suppose a training holiday, not training holiday, but like you need to pull that intensity back. You can keep the intensity up or take the volume way back.
Yeah, that's good. Thanks, Robbie.
There's a couple of nice exercises I can send on to you if you want.
Good man, do that, will you?
Yeah.
Thanks a million, Dermot. Jerry, did you have your hand raised there, I think, as well, if you wanted to unmute yourself?
Am I muted now?
You are indeed, yeah.
First of all, I want to say thank you to Robbie for an excellent presentation, covering all the areas of direct interest to me as a coach, in particular the recovery that he was emphasizing, and not just the recovery, but also the challenge the coach has when the athlete is doing other sports at school, and some of that involves getting in school early and doing something afterwards, and then going along to train. So it's a continual challenge to make sure that the athlete is not actually tiring him or herself out. The sleep emphasis was excellent, because I take a bet that most of our young sprinters, I'm a sprint coach, don't put their phone down before they go to bed, and they're sending messages all the time. So perhaps they don't just get enough sleep. So just making those comments and complimenting Robbie.
Thank you, Jerry.
Thank you very much.
We appreciate that. Nice to know that we're helping the coaches too.
It can be a difficult one that with regards to youth athletes who are playing across a couple of different sports and codes, because unless they're all rowing in the same direction, you see it even like if you've got a kid there that's maybe involved in GAA and soccer, say, and then you have, they're doing athletics as well. They're doing that probably in school, in club, and possibly county or national level. So you see it all the time. There's these really, really promising youth athletes who are just flogged, I suppose, to the point where they either resent the sport or they break down with these recurrent kind of training injuries. And it happens at a young age. So as a result, they don't have the same appetite. And like some athletes will make it through that, and that's fine. And it doesn't mean that you have to specialize into just one sport. It just means that maybe there needs to be a level of communication between the couple of sports or the different coaches involved to say, right, well, this week we're doing, 4 or 5 matches there. So what do we need to do here to allow them to perform to their best capabilities, but not, I suppose, put them at risk of injury?
There's a few more questions. There was one kind of, I suppose, more specific to yourself, Robbie, there about how long before a competition is it okay to get a sports massage?
So there is no right or wrong answer to that. It depends on the individual. Like I have some say distance runners that would come in and they don't want say deep tissue the day of, or some sprinters won't want deep tissue the day of. They'll only want it after. I'd say that's more, it's athlete dependent, and then I suppose event dependent as well. Because it differs, I know, between endurance athletes and short distance athletes. They tend to want them at different points. So I'd say see what works for you. If this is, and I presume this is a youth athlete, if sports massage, it is important and it's a nice recovery modality, it is, but it shouldn't be the be all and end all leading into that competition.
Perfect. And then there's just 2 more, and they kind of, I suppose, link in a bit with each other. So the first one was about how long before a competition you should be resting. And then the other question was if you were sick a few days before a competition and didn't get proper sleep and nutrition, what you should do.
For how long before a competition should I rest? That's probably, it's dependent on, I suppose, the event in itself, what you're doing. Like most athletes would have a schedule. Like Grace, probably when you're running, you probably have I don't know whether it's a 1 day, 2 day.
Yeah, like I suppose I'd have a very specific, like I would know now if I had a race in 2 or 3 weeks time, I know exactly what that week looks like for me as an athlete and what works for me. Like I'll take my rest day 2 days before the race and do my shakeout the race the day before, and like my mobility and stuff the day before, and it's very low intensity just to get myself moving. So that's the way I would approach it for myself. Again, I think other athletes might have different ways of approaching things. Other athletes like to rest the day before. So again, it's probably, you're all quite young as well, and like I've been running for a longer time than a lot of people on the call, so that's taken me a good while to figure out that works for me as an athlete. Maybe you're not there yet, so that's probably a question as well to have a chat with your coach about. Have a discussion with them, again, open up that line of communication with your coach to get their opinion on it, and also don't be afraid to put in your own views and what works well for you. But yeah, that would be my take on it, Robbie.
Yeah, and like you said there, that's something that you've developed and kind of molded to fit you. So I don't think there's probably, like, there's some athletes, like you said, would differ. But I suppose it's what suits your schedule and what makes you feel good coming into that race then.
Yeah, it's all about that, really. It's like what's going to make you feel like the most relaxed and kind of energized and confident going into race day. So creating that routine for yourself, and that looks different for everyone, because sometimes I think, especially when I was younger, I used to like see what everyone else is trying to do and maybe copy that. But again, it's not about copying someone else's. Like, you can take inspiration from other people, but it's about figuring out what works for you as an individual.
And not getting caught up, because you can see it sometimes in warm up or prep areas, and they look and they see maybe there's an athlete who's done quite well previously, and they're doing next to nothing in their warm up,
Yeah.
Then you as an athlete think, all right, maybe I need to do less, but you know that you feel better when you mobilize more before you race, before you compete. So it's not just like you said, looking and see. You can take pieces from that and go, I like that drill, I'm going to implement that. But finding what feels good for you is probably more important.
Yeah, absolutely. And then I suppose the other side of that question, you know, if you were sick a few days before competition and didn't get proper sleep and nutrition, again, you know, the thing that you need to look there is like, you were sick, like, was there enough recovery time for you to get back to a healthy position for that competition? You know, what's the best outcome here? So for me as a coach, or for me as an athlete, I would be looking at the long-term health. So don't be, I suppose, trying to get back to race if you're not like 100% healthy, because like, as Robbie said a lot tonight, you know, our injury risk is a lot higher if we've been sick, if our sleep was poor, if our nutrition was poor. So your first and foremost thing there is to make sure that you're back healthy, that maybe you've back done like a full proper week of training, and that your body reacted well to that. So in my opinion, I'd probably wouldn't be going to the competition. But again, those are conversations for you to have with your coach.
I think as a youth athlete as well, it's important to remember that you've got so many years and so many races ahead of you, that even that race seems like,